Hello, how are you? I'm John and I work as a bricklayer. I was in a motorcycle accident and had to have my right leg amputated. I need help. Could you guide me so I can get my job back?
Yes, of course. I will guide you. There are some simple precautions that can make a difference, such as, for example, care with the positioning of the residual limb, desensitization, and bandaging.
What would this positioning of the residual limb be? I didn't understand.
The person who has undergone an amputation must be aware of the positioning of the body segment preserved after surgery or trauma. This preserved segment is called residual limb. For example, if the amputation is below the knee, you should not keep the residual limb bent or use crutches or canes. It is not recommended to leave it hanging off the bed or chair or crossed under the leg. It is not recommended to support the residual limb under pillows when lying or sitting, nor to place pillows under the spine. For amputations above the knee, you should not remain sitting for a long time. Lying on your stomach helps a lot in stretching the anterior muscles of the residual limb and prevents shortening and deformities that can prevent the prosthesis from adapting to your body.
I see. I was doing it wrong then. I was sitting for a long time without proper care. Thank you for the information.
You're welcome. During the first few weeks post-amputation, some people may feel pain or as if they still have their leg, the so-called phantom sensation. Have you ever felt anything different like this?
Yes, it's like my foot is tingling.
To reduce pain and phantom sensations, a simple technique called desensitization can be performed. You can do this with simple materials, such as cotton, dishwashing sponge, toothbrush, towel, and ice cubes. Use one at a time, smoothing it over your skin, slowly increasing the frequency and duration of movements, always respecting your tolerance. The ice cubes, cotton wool, and toothbrush should be gently passed over the entire surface of the skin of your residual limb. Press the towel and pass it over the entire surface of the residual limb, always slowly and delicately. Use the yellow or less rough part of the dishwashing sponge, passing it over the entire surface of the skin, being careful not to hurt it. Another resource is the toothbrush. Give it light taps with the brush, preferably with soft bristles. Also, give yourself a massage. Use your fingertips to make circles, pressing gently and continuously. Start movements from the bottom of the residual limb to its highest portion. Additionally, you should always inspect the residual limb. Take a good look. You can use a mirror. If you identify any spots, bruises, or secretions, you should seek care at a health unit.
Very interesting. These are simple things that I can do at home without any difficulties. I've seen someone wearing a bandage on their residual limb. What is it for?
Oh, yes. Compressive bandaging of the residual limb is super important. It aims to reduce a swelling and prevent its increase, stimulate metabolism, shape and prepare the residual limb to facilitate its adaptation to the future prosthesis. You should seek guidance from a professional to carry out the correct bandaging. Important. Healing must be complete before elastic compressive bandaging begins.
And is every person who has suffered an amputation able to use a prosthesis?
No. Everyone needs to undergo an assessment with specialized professionals to identify the possibility of prosthetics or not. Just the desire to use a prosthesis is not enough. Prosthetics can be made with various types of materials, such as steel, wooden components, plastic, which will have a weight. The person needs to be able to carry and move this device, which does not move on its own. For this reason, it is evaluated, for example, global muscle strength, residual limb, pain, discharge capacity, contact capacity, which is a specific assessment, skin condition, presence of contracture and deformity, function of the upper limbs and/or spine, degree of mobility, use of a walking aid device, ability to remain standing, range of movement and sensitivity, cognitive assessment, orientation in time and space, other senses, vision and hearing, multimorbidities, changes in the limb contralateral to amputation, pain, injury, deformities. These are some aspects of a broader assessment.
Right, many aspects really need to be evaluated. After all, it is not a simple process to place a prosthesis.
True. An amputation causes a great social, emotional, functional, and physical impact on the individual's life, which promotes a change in their lifestyle. Therefore, appropriate treatment must understand and consider the person globally, respecting their individualities.
Thanks for the clarifications. From today onwards, I can understand a little more about some important precautions that I need to take.
You're welcome. Be sure to look for a rehabilitation center and qualified professionals for appropriate care for your needs.